Delighted to be joined today by Dr Elyssia Bourke, who is the chair of the fantastic Australian College of Emergency Medicine Clinical Trials Network. The network was established way back in 2007 and was one of the earliest formal emergency medicine research networks globally. It's had many successes, such as the RISE trial, an early goal-directed therapy for septic shock published in the New England Journal of Medicine, and the PCO trial, looking at pharmacological management of acute severe behavioural disturbance in children, led by Elyssia herself and published in Annals. Elyssia has kindly agreed to allow me to really dig into both the foundation and the function of the network, which has been a huge success in Australia, to help us with our own plans to deliver something similar here in the UK. So first off, thank you so much for agreeing to speak to me today, Elyssia. I wonder if I could start by asking you to introduce yourself and tell us what prompted the creation of the ACEM Clinical Trials Network.
Thank you very much for having me. And I hope, fingers crossed, that this is the start of a strong collaboration between the two networks moving forward. In terms of my background, I think that summarizes it fairly nicely, but I'm an emergency physician by background, and my interest is obviously clinical trials. And as you've alluded to, a lot of my clinical trials work until now, the multi-center work that I've led has actually been in the pediatric research space. And in regards to the ACEM CTN, I was not involved in the conception of the CTN network. And in fact, I've only been involved with the executive for now around 3 years or so. So a lot of what I'm going to discuss today has come from, I've been back to speak to some of the founding members to make sure that what I was putting on record was correct. But hopefully it provides a fair record of why the CTN was created. But it sounds like the ACEM CTN actually was formed perhaps in similar ways to the network that you're kind of getting going in the UK, in that it was actually started as a clinical trials group. And prior to it being a clinical trials group, the setup within the college at that stage was that there was a scientific committee who oversaw research activities within the college and also organised our annual scientific meeting, the scientific content. But I think the thought from the group of trialists who were active at that stage within the college was that there wasn't enough advocacy and support specifically for clinical trials. And so they got together and formed under the auspices of ACEM, but it was quite there was, I guess, no formal governance structure at the very beginning of the group at that stage, the clinical trials group. And then over a number of years, they then advocated for the clinical trials group to become the clinical trials network. And quite soon after it became the clinical trials network, there was it was evident that there was a very interested and keen group of trialists, but there was very limited support, both administrative and financial. And for that reason, and also a number of other reasons within the college strategically, the ACEM Foundation was then formed, which then now provides some overarching funding, both to research, but a couple of other streams within the college, which are important. So that's kind of the conception of the network. I guess the other thing that's important to say up front is that around the time that the CTN was formed, another network, our Eden network, the Epidemiology in Emergency Departments network, was formed, just goes, I guess, like our sister network. And then we also have an overarching research committee who sits kind of over the top of the two networks. The idea being that overarching research committee guides overall college strategic research priorities, and then the networks are there to do the doing of the research itself.
What about the governance? So how does the committee, does it report to the research committee?
Yeah. In regards to the governance, both of the networks do report to the ACEM Research Committee, and then the ACEM Research Committee reports to kind of a higher organisation within ACEM, and that is very valuable because it means that there's lots of different layers to make sure that the direction that we are going aligns with ACEM priorities more broadly, and that it's a sensible direction. But it does add some additional layers of bureaucracy, which means that any changes, even within, say, the network's terms of reference, as an example, can take quite a long period of time to be enacted. So I think there is advantages and disadvantages to being seated within ACEM or any college, and obviously, yeah, that does come with advantages and disadvantages.
Within the CTN itself, do you have a sort of a steering committee, a board, or? How does it work about making decisions about what you're going to study?
Yeah, it's a great question. So the way that at the moment the clinical trials are kind of guided really is most of our trials, including ARISE, which you mentioned, and PTO, are both actually, and in fact, all of the trials that are currently endorsed clinical trial network studies are actually often conceived by members of the network itself and then brought to the CTN for endorsement rather than the CTN executive saying, this is what we want to do as our next CTN driven trial. So it's a little bit different to some of the other research networks within our country and perhaps elsewhere. I know that the anaesthetist, the ANZCA CTN, very much most of the trials ideas come from within the executive and are then executed by the kind of broader membership body, whereas we're almost the reverse of that. We are trying to work out whether that is the best way to do things strategically. I'm not really sure. And generally, there will be multiple members of the executive who are involved in the endorsed trials because they're obviously the interested trialists, but it's not normally that the executive gets together as a steering group and decides what the next kind of strategic goal is, and that we would then put grants in towards that specific aim.
So you adopt studies essentially, and then what support then does that give a study if it's adopted, and how much ownership does the CTN have of it?
Yep, good question. So I guess there's two levels of what I would view as support that the CTN can provide. The first is in the very early granting phase, and I don't obviously fully understand the UK granting system, but for us having support from higher bodies, whether that's in-kind or financial support, is very helpful. So at that stage, we can provide a letter of support with a degree of in-kind and often financial support from the college to support the larger levels of grants. And then once a study has grant funding and it's clear a multi-centre trial is going to go ahead, then there's an endorsement process where the protocol is reviewed by the CTN executive. And if we're supportive of that, and there's a few stipulations, really our key stipulation is that it needs to be relevant to emergency care, and there needs to be very strong involvement at a CI level from someone who's involved in emergency care. Now, we've said for us that preferably would be a FACEM, a fellow of the college, but we are very happy if it's someone else who is affiliated with emergency care, so nurse practitioner or paramedic, someone who we can see is advancing emergency care. Presuming those kind of stipulations are met, then once the trial is endorsed, the support that is provided is that we can assist in advertising. There's a range of kind of college advertising methods to allow the investigators to obtain additional sites, especially sites that they may not have links with, so regional and rural sites. Most of our emergency departments now have a delegated DEMR, a Director of Emergency Medical Research, so we can advertise through that network or other avenues. And then we have a yearly meeting, a CTN like scientific meeting where each endorsed trial is presented. And that's from the conception phase. And so every year that does provide opportunities for the investigators to either kind of promote the trial in the early phase and seek additional sites, or provide updates as to trial progress.
And you're happy to support trials where maybe members of the clinical trials network are not involved with them, but there is engagement from obviously emergency medicine led. You've got the researchers and members of ACEM, but they're not necessarily within the trials network itself. So it's about supporting and facilitating it rather than delivering it from within the trials network itself.
Correct. That's exactly right. And actually, to be completely honest, I think in some ways, because we really want to build capacity within the system. So in many ways, I think actually our preference would be that we are able to support those trials that we may not necessarily, that none of us are involved in, because I think that's very helpful in terms of increasing the kind of diversity. And generally what happens is that those individuals do end up then kind of getting sucked in and involved within the network more as the trial goes on. But yes, definitely that is our aim, really, is to provide a kind of central point to allow for trial awareness and advertising, but it's not necessarily that we are the decision makers around the strategic direction of trials.
See, yeah. And is it trials only, or do you support other research methodologies?
That's a discussion that is of a hot topic in our network at the moment. The reason being that I think we can see that there's a group now of relatively experienced trialists, but engaging, while ensuring that we have avenues to allow early or emerging researchers to become engaged with research and build a track record across some of the centres which may not have experienced researchers is proving difficult just on the basis of trials. And certainly when both the CTG was formed and it became the CTN, the sole purpose of the network was going to be that it just delivered multi-centre clinical trials. But the way that things are set up at the moment, Eden is very focused on getting up a registry of routinely collected emergency department data. That's their kind of sole aim, rather than observational research work. And then our sole aim is trials. And that leaves a really big gap in the middle for both observational research work, survey work, all of the kind of preceding work that might be relevant and important to ensuring that these trials are actually designed in a sensible way and represent how emergency clinicians are caring for patients, if it's a comparative effectiveness trial, as an example, in the community, and also allowing the track record to be built amongst a group that then could go on to apply for competitive grants. I think it's looking very likely that the CTN will actually incorporate that other work into the CTN's kind of auspice, because it doesn't fit anywhere else.
You obviously have, I think, slightly better funding within um, your structure within Australia. Obviously, you're lucky enough to have a research lead in each centre.
Yep. So, in regards to the directors of emergency medical research, the college has a policy that, in an ideal world, everywhere would have a 50%. So, like if you've got a full-time appointment, that there would be someone who would have 2 days a week nominally dedicated to research. There's not many sites in which that happens, even though I work at a very large quaternary centre in Melbourne. But there is not many sites outside of those kind of centres where that is the case. But most sites will have someone who is, in many places, most places, has 1 day a week dedicated to research, non-clinical time.
I think you have some funding from the college for the network. Is that right?
In regards to the support provided by ACEM, I guess there's two avenues. We do have a network coordinator. They are not a specific CTN network coordinator. And I think, as I mentioned before, I've just seen the difference from some of the other networks I've involved in, where there is a specific network coordinator who that's their entire role and is kind of able to push things forward. A lot of that work, I must say, in the CTN is done by the executive members themselves. And then the network coordinator, they assist us to organise the executive meetings, and they'll provide the agenda, minutes, ensure that those meetings run, which they're not actually that frequent, probably, well, at least once a quarter, I would say. And then what often happens is within those, the executive, we work out various other priorities we need to progress and form little working groups. Most of that work, though, in terms of organising those working groups, the timing, minutes, whatever is required, is actually done by the executive themselves. The research committee has a little bit more robust college support, and so which is important because it obviously provides that strategic direction. But within the CTN itself, that's kind of the main support is the network meetings, and then they also will assist with distribution of newsletters. So we would obviously create the content, they organise for the distribution of those, and then we have a network forum which they also moderate, where network members, we can post things that might be of interest on there, and network members can post questions, queries, these sort of things, which is moderated within the ACEM platform.
You also have a symposium for the network itself. Is that right? That's
We do.
separate to the ACEM conference. I think you touched on that already. So you get studies that you've endorsed, you invite them along to present.
Yeah, great question. So I must say we have very good support from the ACEM team for the research symposium, and that's a priority for them. So there's a significant number of ACEM staff from the ACEM events team who are involved in assisting us to organise this symposium. So the most recent symposium in March ran over 2 days. The preceding 2 or 3 years have been 2-day conferences as well, but prior to that, it was just a 1-day workshop. And the setup is that all of the ticketing, marketing, and all of the financing, organising is actually done through ACEM. And the setup is, as you've mentioned, that the endorsed trials are all presented. We also have a number of keynote speakers around various topics that we think might be of interest from a research perspective. And there's like we call them deep blue and Shark Tank presentations where people can come along and bring their ideas that are in early kind of a conception phase or ideas that are nearly ready to go, where they say they just want some feedback either prior to submitting a national grant, or they've got the funding and they want to seek additional sites. And then there's the very early phase where people are like, do we think this idea might work? And then there's feedback, obviously, from those members that are there that are happy to provide that feedback. The only real mandate around kind of presentation and publication is that the publication is branded as on behalf of, or in collaboration with, depending on how the authorship has worked, the ACEM Clinical Trials Network. But there's no other kind of stipulations or mandates, because a lot of these trials are actually investigator-initiated trials from outside the network that we're just supporting, if that makes sense.
And I presume people can join the network, so you have membership as well as the steering committee.
We
So
do. I think we've got like just over 300 members or so at the moment, something like that in terms of the membership base.
what's the benefits for members, and what do you ask for them in return?
So I think there's not a huge amount that we ask in return from members. There's certainly no specific contribution. They don't have to attend meetings. There are open meetings that they can attend whenever they choose. In addition to that, there's obviously, as I mentioned, the forum in case they want to ask questions or they want to get involved in research or they have something they're not clear on where to go, what to do, these sort of things, that they can post that on the forum and someone will be able to assist them. That might actually be another member. It might not necessarily be someone from the executive necessarily, but someone from within the network. We also host, things like webinars around research topics, which are advertised to everyone, but obviously the purpose is from the membership base. And we try and design those for the members specifically. So if there's topics that they might be interested in, we will try and source a speaker if there's not expertise within the group to provide that information. And then, of course, they get invited to the symposium. So it's really just meant to be similar to how the executive is aiming to facilitate multi-centre collaborative trials. It's just trying to bring the kind of like-minded group of people together, provide some education and support for multi-centre trials, and kind of further the research agenda.
So you do a lot of mentorship with it. We've got something called the ARChem NIHR incubator, which has been a real success over the last couple of years in the UK, which I think probably fulfills some of that purpose. But that is also what the network does. It sort of brings along the next generation of trainees and academics with emergency medicine and mentors them as well. Is that right?
Yeah, that is the idea. To be honest with you though, Matt, I think we probably do need a more formalized system like the incubator method. At the moment, a lot of that mentorship actually happens within the emergency department under the DMRs often. But I think this is a big part of the reason and part of the discussion that we feel that it would be valuable to bring those other kind of research streams into the CTN, because we want to make sure that there are actually opportunities to be able to formally mentor the kind of early and emerging group, and have opportunities for them that would fit within the network space. So at the moment, although we are all very happy and open to providing mentorship, there's not a formalized mentor program, which I do think is a gap within our network at the moment.
I mean, it sounds like you've obviously come a long way. What barriers have you faced if you were going to start this again? What would you do differently, and what advice would you give us if we're just starting off on a trials network?
Yeah, it's interesting. As I said, I've obviously not been involved since conception of the network, so I'm sure that there would be many other things perhaps that are viewed as barriers that I wasn't aware of that had been remediated before I joined. I think there is some really large advantages to being seated within ACEM, as I mentioned previously, but I think being seated within a very kind of complex governance body, which all of the colleges are by their nature, and I think that's for good reason, does also come with some challenges. And I think that does just mean that a lot are changing things or altering processes can be quite slow. Having said that, I don't think it's been an insurmountable barrier. I think the other issue for us, to be honest, is in regards to And perhaps this might be something that is just in the nature of how we've set things up, that it's not actually the CTN executive themselves that have the strategic direction and are guiding the direction of the kind of the next grant, and it's rather the investigator groups that are bringing trials into the executive. Is that I think it's hard then as an executive, we as a group, although we are often involved in each other's work, have quite separate track records. And I think that makes it difficult then for the executive themselves to then drive trials forward, or bring, as an executive, early and emerging researchers in to put them on a grant to have enough track record to kind of go forward with. And I think that's something that we're working on at the moment. But again, I think that's something that is worthwhile considering in the early phase of the design of the network, just to make sure that you are going to be competitive for grants moving forward. And I think for us, that's become very evident because there's been some recent infrastructure grants, which we thought would be very valuable in terms of growing the network. But then I think it became very clear that although there's kind of spots, we don't have as an executive kind of a cohesive story to tell about the work that we've done together outside of the network. I think those are probably the key barriers in my mind at the moment, in addition to the stuff that we've already spoken about. And the other thing that I've just written down here is how you engage and bring people in, which again is probably down to how you decide to structure things in regards to the network. And I think keeping the network base engaged for us, like we're obviously geographically a very large country in Australia and New Zealand. Aotearoa New Zealand is part of ACEM as well. So we're obviously a binational college. So ensuring that we're meeting the interests and keeping everyone engaged is quite challenging.
Do you have membership from non-medical specialties such as nurses, acute care practitioners, physiotherapists, for example, who are interested in being engaged and involved?
We certainly do. So the membership is open to anyone who is interested in emergency care, which I think is reflective of the way that we deliver care in the emergency department. But from a network membership-based perspective, anyone who's interested in emergency care can be a member.
Well, that's great. That's such fascinating oversight and insight into the network. Thanks very much for sharing all those things today with us, and yeah, congratulations on the success of your network so far.
No worries. Thank you, Matt.